It's unlikely we'll see a case of Ebola in our area, but that doesn't mean hospitals here aren't on alert. We visited McLeod Regional Medical Center in Florence. Inspection Control Director Dr. Ramesh Bharadwaj and Intensive Care Director Larry Adams show us how they would treat a patient suspected of having Ebola.
The first thing would be we would place them in isolation to limit the spread. And then that is usually would be worked up further to evaluate if the patient truly has Ebola or not.
Getting into the isolation room is a multi-step process. And when treating patients in isolation, doctors and nurses have something called an anteroom, like this one right here, and it's a chance for doctors and nurses to remove and put on protective gear before and after they treat a patient right here. Gloves, gown, and face shield. It all goes on every time.
What we have is a gown that we would place on to protect if the patient accidentally had any spills or anything. So we would place the gown on. Now we're ready to go into the patient's room. So we would enter the room and we're ready to treat the patient.
Dr. Bharadwaj says only the CDC can perform the test to confirm someone has Ebola, so the agency would be brought into the process immediately. He and doctors across the country are now constantly monitoring information from the CDC and the State Health Department. In Florence, Mark Liverman, WPDE News Channel 15.